So, hello and welcome everybody. This is our little mini workshop for the SpineFitter and how to apply the SpineFitter in the first steps and how to have success in your workplace and also to use it for yourself. I'm very proud to welcome you here in Cologne in my studios in my practice springs. And I'm also proud that Nina Metternich is also with us. She will be watching the chat. And so, as you know, Nina is the inventor of the SpineFitter, and we both created the program to have an effective use of the SpineFitter. Welcome to over 100 participants in this group. And because of the size of the group, we will only allow the chat to be the source of exchange and questions. Please feel free to use the chat and to write your questions, and Nina will be the one following up your questions, and we will address some of these questions during the course, hopefully all of your questions. So welcome again, wherever you are. And some of you will have the SpineFitter. And of course, today I have a SpineFitter, and this SpineFitter is still sitting on my back. Those of you that purchased the SpineFitter know that it comes with a little strap, and this strap actually makes it possible for you to take it like rucksack and take it even on the planes and on the street and walk with them. And one of the reasons why we did this is that you can take it along wherever you need, to your workplaces, to your places where you want to see clients if you do home visits. And it's actually very convenient, and it's also a source of attention if you want that. We are really always, when we wear the SpineFitter on our back, we meet people that are really curious about the product. And so before I start using the SpineFitter with you, I have it on my back. Today's mini workshop is supposed to tell you the first successful steps, and I will go with you through some of the exercises that we experienced as being very useful. I will also share information with you about indications and contraindications. And since most of you will be physiotherapists or athletic trainers and you want to use it in a professional background, we would like to give you all the information that you need to have a good, successful, and responsible application of the SpineFitter in your workplace. After this course, you will be invited to a professional 4-hour workshop that will then certify you. And this workshop we will give you in a link. It's already in the chat, and we will continue putting it in the chat for your registration purpose. It's going to happen on the 5th of April, and feel free to use the link that is in the chat to look at it at any point in time. It might not be active already, but during the next days, you will be able to register. For those that don't have a SpineFitter and you're thinking of getting one, please go to the Health Performance website, and you can order the SpineFitter in various colors. It is not a difference in the resistance in the SpineFitter. It's only the color that you prefer to have. And in our case, I have now a green one. You see the elastic strap around it. I can take it easily off in order to use it for my exercises. And you, of course, can also take it, put it easily on again. So if you need to order the SpineFitter, please go to Performance Health. And I would like to let you know already now in the beginning, even before we go into the exercises, that there is an option for you to have also the possibility to have resale in your studios. So if you start liking the product and your patients and clients liking the products, there is the possibility to order a bulk order, and then you can resell it in your studio. So any point in time when you need help and assistance for this purpose, please write to Performance Health, or you can also always go to spinefitter.com. and help the community, the world, the global network to discover the benefits of the SpineFitter. So I would actually like to have a count who has the SpineFitter in his place, but this is a bit complicated with such a big mass of people. And case, please, if you don't have, and go with me through the thought processing, and then as soon as you get it, please start using it. And there is a lot of free video exercise sequences on our website, spinefitter.com, where you can always readdress the exercises that I did today. Let me show you a few of the benefits of the SpineFitter, and I will just share the presentation with you. That will explain a little bit of the benefits. So we like to talk about the product as being able to bring the back in balance. And we have the key component of symmetry in our SpineFitter application. And we all know that asymmetry is causing pain, it's causing tension, and it's also causing an early wear off of healthy tissues. So when we talk about alignment, it means that the axis and the alignment of the joints should be in symmetry, and it also should be in a stable relationship with each other. So when we have asymmetry, we would love to have a tool in order to create the symmetry that is more healthy for the body. When we look at other effects of the SpineFitter, we have to look at the muscles that can develop tightness, trigger points, and tension. And when we start looking at the SpineFitter from the muscle level, we can see that we can loosen, we can soften, we can release tension in the body. And these release of tension in the body also creates a more symmetrical activation of the muscles. So if you have clients with this kind of symptoms, back, neck, shoulder, restriction in mobility, especially in thoracic spine and head and neck, but also in the limbs. If you have people that have diagnoses of pathologies that are referring to chronic pain, this is definitely where you want to use the SpineFitter. So symmetry is not the only component, but it definitely is one of the key components. The next key component is definitely mobility and the control of the mobility, which we like to call stabilization. You see here the three principles in one slide: release of tension, mobilization of the joints, and then strengthening of the deep muscles that are actually able to give an appropriate stiffness and stability to all movement purposes. I just wanted to show you a few of those slides, and then we go into the practical application of the exercises. I always think that the release of tension is not something that's just purely tension in the muscles, but it does have the effect on the autonomic nervous system as well, which then enables us to have effects that are more surprising to a lot of clients and actually also to some of the professionals that are using it. Why do I have a decreased blood pressure? Why do I have a better metabolism, digestion, when I'm using the SpineFitter? And I want to draw your attention to the fact that through the release of tension and through the stimulation of the autonomic nervous system, this is one of the explanations for having these results. But of course, most of us are looking at mobilization of the joints. We do have a lot of clients and patients that have a lack of mobility. And of course, spinal mobility and definitely segmental distribution of mobility is a key factor to injury prevention. So when we look at mobilization of the joints, we look at a risk reduction for injury. And the SpineFitter is actually built in a way so that it does apply appropriate mobilization impulses and stimulation to the facet joints. And the facet joints are the leading structure of all of the equally distributed alignment and mobility in the spine. But of course, we have to use the mobility in order to create strength and stability. And we all know that the deep muscle layers and the muscles that are actually really interconnecting all of our joints and all of our segments are most important. So therefore, this is the SpineFitter principle number 3. So when we address with the exercises the different areas of the body, always think of the 3 SpineFitter principles, which is releasing of tension, mobilization, and strengthening and stabilization. Okay, I will bring you back and let's do a first set of exercises and the first set of tests before. So I am very interested in showing you how effective actually the SpineFitter can be by testing and retesting. Okay, so can everybody see me? Here you go. Let's do a few tests. So stand up with me. If you have the SpineFitter, have it close to you because we will use it very soon. But for now, you can put it down and focus on the test. So when you're ready, I want you to stand. I will stand sideways so you can see me and just do a standing roll down activity. So having equal alignment and a good axial elongation, just rolling down towards the floor. And there is 2 things that you should look for. You look for discomfort and you look for how far can I go. So once again, start from standing, and from here, just start rolling down and see how far you can go. Can you touch the floor? Can you touch the floor with your whole hand? Is it 10 centimeters away or more? And how, that's the second question, does it feel? Do you feel tension in your lower back? Do you feel stiffness in the back posterior fascia line of your body? And what is the overall amount of movement that you have? That's test number 1. Let's do test number 2. Stand with your arms reaching to the side. And now start rotating your upper body. How far can you go? When you look to one side, remember how far you can look, and also remember where you're standing right now, because we want to do a retest after a few SpineFitter exercises. Let's go to the other side. And there's 2 things you look for. One is, how far can I go? And the second one is, how does it feel? So do I feel pain? Do I feel restriction? Do I feel discomfort when I turn? That is the second test, the second assessment tool. And the third assessment tool applies to stability. Now, please stand on one leg and just keep your balance as good as possible. And of course, we're different on both sides, so try the other side. And remember how it feels. How much stability do you feel? Is it symmetrical or asymmetrical? And how stable am I? So these 3 tests, we do have the roll down, we have rotation in the thoracical, and the stability test will be our tests to prove if the SpineFitter is effective. Now, those of you that have a SpineFitter, just take it. And just to demonstrate that one more time, how flexible the SpineFitter is and how much like a spine it actually can bend and rotate. You know, you can play with it a little bit. And actually the distance that you see between those balls and the segmental distance is something that we really researched on deeply in order to match the need of the spinal column, the spinal system. And just think of your spinal facet joints, how they can finally really come into that form. And later we will talk some pathologies, of course, but one of those pathologies that's, of course, very interested to use it is scoliosis. And scoliosis will, just by lying on it without doing a lot of exercise activity, be corrected towards more symmetry. Okay, let's do the first exercise. So put your SPINEFITTER on the floor. And in order to get onto the SPINEFITTER in a good way, you will sit on the lowest part of the SPINEFITTER. And now use your hands to support your body weight as you roll gently down. It is very important that you roll down very slowly and gently, because your mobilization will already happen as you roll down. Once you're on the SPINEFITTER, maybe you have to move a little bit down or up in order to have your occiput on the upper balls and your sacrum on the lower balls. Of course, some of you are taller, and this is why we have created the so-called connector. So if you are taller than me, I am 1.80 meters and I fit exactly great on the SPINEFITTER. There is this tool that we call connector, which can be used for various things, but one of the ideas is that you can make it longer. So you're adding 4 more balls, 2 more segments. And then in the case you're a little bit taller than I am, about more than 6 feet tall, you can add the connector and just roll down slowly again. And then you should be able to really touch with your sacrum and your occiput all of the SPINEFITTER. Now let's start with principle number 1, lifting your arms up to the ceiling. And we want to release tension in the shoulder, head, and neck area by just pulling your arms up towards the ceiling. Use your inhalation to support it. And as you exhale, slowly drop your shoulders into the SPINEFITTER. Let's do 5 repetitions. And when you do these, just think about the effect that you're having. So the balls of the SPINEFITTER will touch your medial and your upper trapezius, some of the levator scapula, and also some of the teres musculature. And as you move in and out, the balls of the SPINEFITTER hit the trigger points, hit the tight muscles, and give them a massage, a release of tension. Remember principle 1. Next exercise, start circling your shoulder blades. So you're continuously lifting them up towards your ears, down towards the floor, and reaching up and over with your shoulder blades. This is a very basic second exercise. Third exercise, start moving your arms in circles. And this will open up the front line of your chest and shoulder, and you will gain more open mobility in the connection between your shoulders, your arms, and the chest. And then let's go into thoracical mobility by just reaching with your fingers forward. You can use your exhalation to come up, look at your thighs and at your belly, and then you start rolling down into the SPINEFITTER. This will result into a mobilization of your upper thoracic joints. And sometimes you will already feel the correction of the facet joints as you go up and down. Let's do 1 more of these basic exercises, and then we will already do a retesting. We will do a bridge, a pelvic bridge. Put your arms down to the side, roll up with your pelvis until you feel the spalls of the spine fitter pressing into your thoracic spine. Your head and neck area does not receive any more tension. You're putting the weight only on the thoracic spine, and then you're rolling down again on the spine fitter. Let's do this spinal articulation 5 times, clearly addressing a hypertension of the outer surface layer of the back muscles, the fascia line, and definitely also the autonomous nervous system, because we are touching the ganglia roots. We're actually working on the spinal transversus joints that have a very direct connection to your sympathetic nervous system. Use your breath to help, and then you can roll all the way down. Beautiful. Okay, in order to come up from the spine fitter, you can either roll to one side and just roll off onto the floor, or you help yourself with your hands, articulating, sitting up straight again, and then stand up for me. So very quick and short set of exercises that almost everybody should be able to do. Now, in your home, in your workplace, wherever you are, let's do a reassessment. We did assessment number 1. Let's reassess the standing roll down. 2 things: how far can you roll down? Second thing, how does it feel? So compare before and after. Test number 2, thoracical rotation or spinal rotation. Rotate to one side and the other side. How much can you rotate and how does it feel? Assessment number 3, standing balance. Try one leg, try the other leg, and go down. Okay, so of course I would now like to do a little bit of survey, and you can write in the chat if you have experienced improvement, and we can go on a count for the improvement. So if you had an improvement in the standing roll down and thoracic rotation, or in the standing balance, just give me a thumb up in the chat, or just write whatever you have experienced, and we can have a look at it and we can comment on it. I want to talk a little bit to you about contraindications, because if you have a workplace with a clinical setting, of course, there are clients that you have to be cautious of before you're putting them on a spine fitter. What could be a precaution for the spine fitter? The balls of the spine fitter put pressure on the soft tissues. We're talking about tension release. So if you have a client that has a soft tissue inflammatory state, which could be something like fibromyalgia, or also any kind of a local inflammation, a bursitis on your hip, or it could be a healing wound, or it could be also tissue that is relating to osteoporosis, where you have the pressure on facet joints and on bony landmarks, but also the tense and tight and tender areas around it. In this case, we would like to use a towel that you cover, that you put on top of the spine fitter balls. And we also have developed a tool that you can use in addition to that, which is what we call the linum. In the spine fitter system, you have, in addition to the connector, which makes the spine fitter longer and more applicable for certain exercises, we have the so-called linum. Linum is a softer surface, as you can see, for the spine fitter, but it's also heatable. You can put it in the microwave, and to be honest, in the physical therapy rooms here, we sometimes just put it on the heater, and then it heats up very slowly, and then we can use either the warm spine fitter or the heated linum. If we don't want to go to the microwave, just applying a little bit of warmth, and this will help then the system, the tissues that are too tight or too tender, to soften and release even more. So this is one of the precautions. Another precaution that can turn into a contraindication is pregnancy. Because in pregnancy, you want to be careful with the stimulation of the autonomous nervous system. And there will be also areas in the pelvis where the women experience too much irritation or even too much tightness and irritation altogether. So in pregnancy, we do need to tell our clients and patients that we just want to use it a shorter time and see if they can tolerate it, and then only use it for a proper exercise, which actually opens the question, how long should I use the spine fitter? And how long should I do exercises on the spine fitter? We basically say that the body has to adapt and adjust to the use of the spine fitter. And we recommend not more than 5 minutes in a supine position in the beginning. If you have clients that have experienced the spine fitter successfully and without any irritation, you can use it longer, but you should always be aware of the fact that the spine fitter does give a quite deep and strong input into the body. So it is not really necessary to stay for very long on the spine fitter in order to have the results. Should I use the spine fitter every day? We don't recommend to use it every day before you have experienced the benefits on a more softer and not so frequent use. And so every second day is definitely possible. What about people that have a very tender and irritable head and neck occiput area, so C1 area? The balls will touch this area, and if they are very tight, if they have subacute headache, we recommend also to put the linum or just a tissue on that area so that the head and neck area is softened a little bit. The same applies to pelvic area. If your pelvic area is a little bit irritated, you can use a towel, a pillow, or the linum to make it a little bit softer. One of the precautions is if you take blood thinner or if you take pain medication. With pain medication, we don't want to have a strong trigger in a tool that is probably misinterpreted by the body. So if somebody takes anti-inflammatory medicine or painkiller, please make sure that they are very cautious. They use the spine fitter a little bit shorter, and that we are looking for the results on the next day and the day after in order to see if their body was able to tolerate and balance the system, even with the anti-inflammatory medication. And then the last one I want to refer to is dizziness, vertigo. Be careful with people that you use in supine on the spine fitter, that you put in supine, because we know that some of the vertigo is actually activated from the upper cervical vertebrae. And if you use the spine fitter, soften it again with a cushion or a towel and use it for a shorter time, or use it for other exercises before you address cervical spine. Any further questions to precautions and contraindications? Please put it in the chat. Let's go to the second round of exercises. And for the second round of exercises, I want to work on the component of mobility. So remember, the first principle was release of tension. Second principle, mobility. How can I use the SpineFitter to mobilize spine or other joints? I want to show you that the SpineFitter, if you place it horizontally, can actually help you to mobilize kyphotic backs towards a more neutral mobility. So start with your hands to your sides. Now the SpineFitter is placed at that area where you want to mobilize. Let's say in this case, it's about T5. Now support your head and neck with your hands. And now wiggle until you find the right position for your facet joints that is actually touching the SpineFitter. And now you can move your thoracic spine over the SpineFitter. This moving over will help to slide the facet joints and bring more extension or reduced thoracic flexion. What I like to do is when I come up, I am in the center of the movement. When I go down, I can rotate to one side and then go over the SpineFitter, which will now, in my case, mobilize my facet joints on the left side of T5 as I have positioned my SpineFitter in that area. Come back to the center. And if you need to mobilize the other side, just move to the right with a small rotation and then bend over and lean back. And sometimes you can even feel or hear the facet joint open with a little bit of a click. And then again, in the center. And if it feels good for you, you can stay for a little bit longer in this extension mobilization. And then come back up to neutral. Use your hands to support your rolling up into sitting and sit up straight. Let's use it for the pelvic area. And in this case, we roll down first and put our L5 region on the SpineFitter. And I will bring my head down and my arms to the side. If you have problems with your head lying so low, please use a cushion to support your head position. Now, I want to work on the mobility of the SI joints and also of the region around L5. If I want to increase mobility in L3 or 4, I just move it up a little bit and I place my segments on the SpineFitter before I do the exercise, which we start by lifting one leg up, lifting the second leg up. And now you can move your legs from right to left and feel the mobilization component. You will touch the ligaments, but you will definitely also touch the spinal joints. And then you can drop your feet. And with your feet dropped, you can do a circular movement. And with circular movement, it is possible to give all of the surrounding structures of your L5, L4, 3 region a nice, deep, soft tissue and mobility effect. Very good. And then put one foot down, put the other foot down, and let's slide the SpineFitter out of your lumbar spine. Nice. So you can roll up, and the SpineFitter will help you to give you one more mobilization, which is more a hip mobilization by stretching the hip flexor, which very often in our patients and clients is tight, shortened, and is restricting lumbar movement. So if you want to use the SpineFitter for your hip flexor mobility, lie down again, and you can actually put it under the pelvis. And now I will hold my right leg with my hands towards my chest, and my left leg can lengthen out on the floor. Because you're lifting your pelvis up, your hip flexor and your left leg will actually now go in a deeper stretch and in a deeper relaxation. Put your left hand on the floor if you have your left leg long on the floor, and now start circling your right hip. And by circling the right hip, you're actually touching with the balls trigger points in the glutes, in the piriformis. And at the same time, you're releasing tension in the posterior capsula of the hip joint on the right side. So the nice effect here is that you're mobilizing with the systems of the SpineFitter, the joint on the right side, as you are lengthening at the same time the hip flexor on the left side. Let's switch sides. So you draw the other leg in, bring the other leg long out, feel that hip stretch on that long leg, and now start mobilizing the bent knee and the bent hip by circular movements. Very good. Bring your legs back. Lift the pelvis up in order to slide the SpineFitter out. If you wanted, you could start doing some of the exercises and see that you have more mobility already as you just do your exercise that is actually addressing in your physical therapy or in your exercise session the mobility part. But we would like to retest again. So stand up. And let's do the standing roll down one more time. Standing roll down. Think of the distribution of the mobility between the spinal segments. So as you roll down, you do want to have even distribution in all of the lumbar segments, but you also would like to engage the thoracic spine into the flexion movement so that you're avoiding straining the lower back by taking all of the flexion. Let's test the thoracic and the overall spinal rotation. And also the interesting observation, how does it feel? Not only how much can I turn, but how does it feel? And then last one is stability. Test your stability one more time. Try the other side. And if you find more mobility and less tension, you will have a very immediate effect on all of these tests. And by using the 3 SpineFitter principles, have a positive effect and a healthy effect on all of the physical structures that are involved. Before I go in the next series of exercises that is addressing the component of deep stabilization, I will look at the chat and see if there are any questions that are relating to what I've demonstrated. Please continue writing in the chat, and I will try to answer some of your questions. So here I have a question. that the spine fitter can use with pregnant women, and I covered that already. So if you're using it with pregnant women, make sure that's not the first trimester. Make sure that it's softened, and make sure that they don't stay too long on the spine fitter, right? And Nina will keep answering your chat questions. Please put them in as much as possible, and then we will always be able to help you. So when we look at the spine fitter, you see that the material has some flexibility. It actually has flexibility in one level plane of movement. This is sagittal, but it also has the flexibility in the spiraling, which is three-dimensional. And this movement will help us now to address the component of stability. And stability is the third principle of the spine fitter. So remember, release of tension, mobilization, and now we will talk about stabilization. And actually, it's so interesting because you have all of these three effects in a very immediate way on one piece of equipment, which is kind of nice. Okay, let's look at some exercises. Take your spine fitter and place it in a diagonal way on the mat. Very good. And now you can put your knee on one part of the spine fitter and the opposite hand on the other side of the spine fitter. So in my case, I have my right knee and my left hand on the spine fitter. Now I will take away my left leg and my right arm, and I will balance on the spine fitter, which actually gives me a very nice diagonal stabilization increase in that fascia and muscle line. So when I go down and when I go up, I have to react and coordinate in the diagonal lines the amount of stiffness and of stability that my body needs in order to stay stable and not fall. Great. Of course, you can also do it the easier way, which is having your hands as a wrist support in your quadruped exercises. So a lot of people have discomfort when they are doing quadruped on the floor. Try to use the spine fitter in a way that your palms of your hands are on the spine fitter, touching one of the balls, and your fingertips are on the mat. You are actually now lifting your wrist up a little bit higher. And now try to do quadruped exercise, leg, arm, and just feel the difference in your wrists. You can also even go in a push-up situation. And by using the spine fitter this way, you're supporting your wrist, but you're also creating a moment of instability in your upper extremity, which will help your body to find appropriate stability. Let's use the spine fitter with our feet, because we know that our feet are the sensors for stability. And when you do standing work with the spine fitter, you always want to make sure that the clients have something to hold on close to them, and you start sideways. So I pull my mat a little bit more back so you can see my head and face, but you will hold on to something, stand on the spine fitter, and just feel this beautiful massage on your feet, on your foot reflexology areas, on your receptors in your feet. This will bring increased amount of activity and alertness in your body. And then you start walking in place like a cat on a bed. And then you can start walking without having your hand close to the wall. And then you can start walking from one side to the other side, stimulating the feet. How beautiful does that feel, isn't it? How nice. You get this massaging, stimulating effect in your foot receptors, in your plantar fascia, in your deep toe flexors, to lengthen and really stimulate them in a good way. And of course, the next step would be to stand in a long, longitudinal way on the SpineFitter, put both feet on it and try to balance. And once you can balance, you can start walking front and back. And once you can do that, of course, you can go squat down, squat up. And once you can do that, you can try close your eyes and see what happens when you take your eyesight away. Always be careful, have something to hold on close to you. One of the most beautiful exercises for stability is not only balancing, but it is actually enabling your body to react and to be more sudden and to be more effective on that reaction. So if you step on a SpineFitter, just lift the foot up a little bit and you step down. Turn around, step on it, hold it a little bit, go to the other side, step down. So this could be a training for fall prevention. If you're just doing steps on the soft, beautiful balls of the SpineFitter, and you are making sure that your reaction is actually causing, on one hand side, the stimulation, and on the other side, the mobilization in your feet and the beautiful activation of reflexology points. And you can go one foot on the SpineFitter, step forward, step backward, step sideways, step diagonal, step backwards diagonal, and we find this beautiful stimulation for your stabilization. Now let's look at your stability. Stand without the SpineFitter, and let's do our test again. Hold your arms to the side, lift the leg up. How much stability do you experience? Okay, try the other side. If you're very brave, hold on to the wall a little bit and close your eyes and see if you can even have your stabilization with your eyes closed. Beautiful. So these are examples of the component of the principle of stabilization of the SpineFitter. And as you can see, it is one tool that actually can do all of these three things. And that is the most beautiful and effective character of the SpineFitter. Okay, so if you have questions to the chapter of stabilization, please write in the chat and Nina will answer you. And let's summarize what we have found so far. And let me also tell you that me and Nina, as being osteopaths and physiotherapists, together with being teachers for Pilates, for SpineFitter, that we see patients in a very wide variety of pathologies. And we are very happy about the results that we have found so far in the application of the SpineFitter. So if you have a professional background as a therapist, you will now hear a little bit about the pathologies and the things and the problems that we are addressing. And at the end today, we will even show you some of the evidence studies that we have done already. So as a patient, you will actually have, if you do the testing and the retesting, a very nice effect on some of your problems. And the very best thing that I think is that you can take the SpineFitter home and repeat those beautiful effects in your own home in a very comfortable and relaxed environment. And therefore, you can increase the therapist's results and success that you have gained in the treatment session by using the SpineFitter for your clients at home during the week before they come back. So let me talk a little bit about the effects and how we understand why the principles of the SpineFitter are actually so beautifully helpful for our workplace. And let me also introduce you one more tool that I want to show you. When we started working with the SpineFitter, at some point we realized that some people were taller and that we had to use an extension, which we call here this connector. When we realized that some people needed a little bit of deeper impact into their soft tissues or deeper mobilization impact into their movement segments, we added the so-called trigger tool. The trigger tool has the option to put it in the SpineFitter. And now you could, as you do articulation exercises with your spine, add a lot more mobilization or a lot more tension release into your SpineFitter tool as you do your exercises. Even for your feet, some people love to put their feet on the trigger tool in standing and then have a much deeper massage and increase of circulation in, for example, the plantar fascia. So what we call the SpineFitter system includes the SpineFitter, the connector, the trigger tool, and the so-called linen surface heatable soft pack that we put on top of the SpineFitter in order to make it even more effective and applicable to your clients. So why did we come up with all of these things, and why is this, in our view, a complete system that actually will enhance your therapeutic approach to your clients? With the understanding of the biomechanical effects, of the physiological effects, of the effects on the autonomous nervous system, on the neurological system, on the balance quality, on the proprioceptors in the body, we have found that the difference between the SpineFitter and other tools that have been in the market, like rollers and black rolls and things that are working on one component of the system, we have experienced the SpineFitter system being much more applicable, effective, and useful for a wider variety of patients and clients, especially because they can use it in the treatment session with you, and they will be assigned to the exercises that are appropriate, and then they can assist and support their home exercise program in a much stronger and much more efficient way. And guess what? Most people just love to come home and not sit down and watch TV or eat, but just relax on the SpineFitter for a couple of minutes with their back lying on the SpineFitter, maybe a little bit of the heat from the linen. I usually put my legs in a 90-degree on my chair or couch at home and just relax and calm down and kind of like give yourself a little break, a little reset before you continue your daily work or your evening program. So in the rooms here in Springs, in Cologne, Europe, Germany, where I am right now, in every treatment room, we have a SpineFitter, and we sometimes just use the SpineFitter for the client and patient to prepare the body for our therapeutic work, which means that I have a much easier job to mobilize manually a hip joint if the client has been already prepared and stimulated and released by the SpineFitter. When we have scoliosis adolescents or adults or kids in our practice, they are asked to come 5 minutes early before their appointment and just lie down on the SpineFitter in order to give their spine already a first component of derotation before our Schroth therapists come in the room and assign them with their Schroth corrective exercises. When we have clients that come to our clinic and actually are in a chronic pain situation, we advise them to come 5 or 10 minutes earlier, lie down on the SpineFitter before they see you as a therapist, and just release some of that chronic tension that they are carrying away with them, and find a little bit more symmetry and relaxation before the appointment and the session actually starts. So let me finish today, and I hope that I will see most of you in our professional workshop where I will cover all of this material in much more depth. Let me finish the day today with talking about evidence. So I want to show you the 3 studies that we have done so far. And actually number 4 is going to be released in a few weeks at FIBO here in Cologne. The first study that we did was about the mobility of the spine and the release of tension in a group of clients and patients that were in chronic pain. In this effect study with a smaller group of people, we had a very high change, a very high improvement in the mobility, and along with the mobility in the release of tension and pain. The second effect study that we did was about lipedema, and you might be very surprised to hear that. But lipedema and also edemas in the legs, in the arms, actually are quite frequent. And when you see these people, they have very limited ability to do something that helps them without seeing the therapist. By using the SpineFitter for this group of people, we made it possible that they had a release of tension and pain, but also an increase of circulation and a reduction of edema in their legs and in their arms. Why this happens? We think that it is because of the autonomous nervous system. That is actually, if you reduce the sympathetic activity and you increase the parasympathetic activity, that this will help the blood vessels, the circulatory system to open, and therefore to take in more of the lymph that has been stored and actually been constricted in the body. Very successful and very interesting study. And the last effect study that we did was about breast cancer patients. And we looked at the restriction of mobility in the arms and shoulders. And we also looked at the subjective reduction of symptoms of tension and pain. And again, this group of people, of women, was so happy to have a tool that was actually helping them to be independent from therapy, but to need the therapist to assign them for the appropriate use of the SpineFitter. So the SpineFitter actually used in a clinical setting wants to enhance your therapy, wants to support your therapeutical effect and success, because the patient receives from you the recommendation, or if you go in resale, even the tool, the SpineFitter itself in your clinic, and you will make your patient and your client even happier. But the last study that we have now been doing is a very big study that is created and designed from an independent scientific institute in Munich in Germany. And it will be published very soon. In this study, we compared physical therapy exercises in the general way, that the general PT exercises that we assign, and we compared it to the use of the SpineFitter and wanted to know if we assign exercises on the SpineFitter, if we have a better result on the clients, on the patients, than if we assign them regular exercises. And I can tell you very promising results that we will publish soon. But that is just to illustrate that we do have evidence, and we do want to create even more evidence through your feedback and through your ideas and through your questions. And this comes or brings my little presentation, our presentation, Nina and my presentation for today at the end. And please write your last questions in the chat. And you can now, I think, see how rich, how big, and how interesting this SpineFitter product can be if it comes into your hands as therapists and teachers that are actually understanding how and why you should and can apply that. Okay? Thank you very much for your participation. I hope you have a good day. Enjoy your SpineFitter.